With 3-year follow-up, we're not finding a lot of new findings when it comes to response rate or progression-free survival, at least in terms of the majority of the population, because we define the response rate, in previous studies as about 75%, and that hasn't really changed. Although notably, 18% of patients receiving the combination have complete responses. That's a higher number with more follow-up. You sort of see the maturation of some responses into complete responses. And so an 18% response rate actually is the highest complete response rate we've seen with any regimen, targeted or immunologic, in metastatic melanoma. So I suppose that is one little highlight. When shifting to progression-free survival, just briefly, now with longer follow-up, we're seeing that almost a quarter of patients are progression-free out through 3 years in the overall analysis, and you can actually subset the patients a bit and find a subgroup that does even better than that. So at 3 years, to still be on therapy and progression-free was a notable finding. In terms of overall survival, that's really the primary motivator of continuing to follow this cohort of patients. And in the future, we'll continue to even pool the dabrafenib trial populations, which is almost 700 patients. But in this analysis, we have 250 or so from the initial dabrafenib cohort. And with 3-year follow-up, we see a 44% survival rate at 3 years. So we'd reported 2-year data last year, and now with 3 years, we see actually that the curve is kind of leveling out a bit. In other words, a little too early to call it a plateau just yet, but those patients who make it out through beyond 2 years seem to be very likely to make it to 3 years. And of course, we'll continue to follow this cohort to see what 4 or 5-year data look like, because those are the types of timelines we're learning are achievable for metastatic melanoma, which is kind of shocking when you consider that 6 years ago we were talking less than a year for 75% of patients. So meaning most patients would succumb within a year's time. So yeah, the milestone data is I think, really the highlight clinical outcome.